Good afternoon. It has been a true honor and privilege for me to be connected with the people of Papoli, Uganda since the year 2000, when, by the grace of God, I was connected with Martha Koala and Emmanuel Afombi, who have become family to me. I wanted to talk to you a little bit about where we've come from our first initial meetings, a little bit of the history about how this all began and where we are today and where we hope to be. Uganda, once known as the Pearl of Africa, is landlocked country. The amazing thing about it is that it's where the source of the Nile is, and Gandhi's ashes are actually scattered here in Uganda at the source of the Nile. It is a beautiful country. It is bordered on the north by Sudan, on the west by the Congo, on the south by Tanzania, and on the east by Kenya. The skies in Uganda seem to be so much closer. I don't know if it's because it's closer to the equator, but it is amazing to see the skies and the beauty in this country. For me, it represents so much of what we're all about. I first became involved, as I said, in the year 2000 when I was contacted by Martha Koala, a young girl who needed heart surgery. With that connection, which I'll speak of in a moment, our church, Papoli Presbyterian Church, became involved, and John Debevoise, our pastor, believed in what he calls the 3 C's of mission, which are to connect, commit, and continue. With our initial connection in 2000, when we asked what it was that they needed in their community, what we were told by Emma was that they needed clean water, education, and care for the elderly and the orphaned. You see, Uganda is a country that was a British colony, but with the rise of Idi Amin and all of the devastation that he imposed upon his country, as well as the scourge of AIDS, there's been a great depletion in the population of those that raise the children. Therefore, many grandmothers are raising the children themselves. My connection began with Martha, as you see here. This is when she was waiting to go for her open heart surgery. I received an email on New Year's Eve that said, "I'm a 15-year-old orphan. I have a hole in my heart. I can no longer walk across the room. My parents both died of AIDS. I have no way to receive help in Uganda. I read a story in the College of Surgeons bulletin that you helped a child in Haiti, and I was wondering if there was any way that you could help me." I had a 15-year-old daughter at that time. How could I say no? So then the journey began. Martha came over, had heart surgery. She and Emma became part of our family as well as the family of our church. And things began to move from there. When we talk about clean water, which was the first request, there are, at this point in time, in the village of Papoli, 30 water sources. 11 of these are boreholes that have been built primarily through Papoli Presbyterian Church and Village Partners International. There are 4 protected wells and 15 spring wells. And these are just some pictures of the children at the borehole that we built. Here they are taking water back to their home. As far as education, with the help of Papoli Presbyterian Church and the congregation there, a preschool was built. There are currently 86 students that are enrolled. There's a capacity for 150. Currently, they go from 8 to 12 noon, but that is probably going to be extended throughout the entire day, which we feel will increase the number of students. They receive porridge that has been enhanced with moringa and other supplements to give them nutrition. It costs $8 a term, or $24 a year for a student to attend the preschool. This is a picture of what the school looked like before Papoli Presbyterian Church became involved. And this is a picture of the preschool now and the students there. Another picture of the preschool, you can see it's a beautiful building and they learn a lot there. There's also a primary school built. The primary school currently has 794 students to cover 7 levels. They go from 8 a.m. to 4 p.m. And during this time, porridge and lunch is given through a program started called porridge for Papoli, where the children are fed. Based on test scores, this school is one of the best in the region, and many people are wanting to come there now. This is a picture of the school before the church became involved, and this is the primary school now, with the students standing outside it. We recently have built dormitories so that people can send their children there to stay overnight and be cared for, as well as to receive an excellent education. The girls' dorm, which has been built, has an 80-bed capacity, and the boys' dorm a 48-bed capacity. And this is a picture of the girls' dorm. The bed's in here. And this is the boys' dorm, which should be completed with the electrical outlet input in the fall of this year for the next class. There are also scholarship funds that were begun, and support was given to students for education, including completion of their college. Currently, one of these children has completed a master's degree, and one is in the master's program. And this is just a picture of two of the children that have completed their education. On the left is Andrew, who is currently employed in Tororo, and on the right is Tabitha, and those are Andrew's 3 children. This is a picture of Martha, who has completed her master's degree and currently is working in AIDS research in Kampala. There also have been homes built for widows and child-headed families. Currently, 135 homes have been completed in this area. This is a picture of one of the homes prior to building, and this is after. This is the same woman, and you can see the difference in the home. It's a small house, but it is more than what she had before. Again, this is a picture of one of the women before. This is a picture that I took showing going from the old house to the new house, and I thought this was so poignant. It was painted on the wall of one of the old houses. This is one of the women who has received one of the widow's homes. She is lame. She has these crutches that were given to her by the community, and she lives outside her new home. And this is a picture of one of the most important things that the community is doing, is becoming involved. When one of the widow's houses became damaged, the community got together and repaired it. There's also a program called Christmas in Africa, which distributes presents to the most needy, which are determined by the elders of the community. These are some of the goats that were given to the needy in the community, as well as a sewing program that has been begun there. Moringa trees have been grown, and the leaves are harvested, and a powder is made that is added to the porridge for the students as well as in the community. There are also citrus trees that have been grown. With the advent of all of these different programs, it was felt that there was more that needed to be done and more outreach. Therefore, Village Partners International, a 501c3, was developed in 2007 to reach beyond the Church of Palm Sea Presbyterian Church and allow other people to become involved and partner with us. This is a partnership with villages to help them help themselves. One of the things that has been built through Village Partners International is the Robert Cooley Pediatric Clinic. There are currently 321 children enrolled in this clinic, and 60 attend a day. This clinic was built for children with HIV and malaria. Children who are extremely malnourished are brought. They are placed into the program. When they graduate, they are monitored, and nutritional support is given in this clinic with 4 servings of food a day. Medical care is given, showering, education. And recently, this was picked as one of the top 10 pediatric clinics in the country. We now have running water and electricity in this clinic. This is an example of one of the children who came to the clinic. And this is a picture of the clinic itself and some of the staff who work there. Food is prepared for the children in a cookhouse, and showers are given. These are some of the girls that are waiting to go and get their showers. You can see, even with the nutrition that's given there, they're still having problems with malnutrition. This is one of the children getting a shower with the running water. This is the only running water outside the main city of Tororo. This is another child who's just received a shower. They love these showers. They truly love them. Food is given at the pediatric clinic, and prior to food, being distributed, a prayer is given, and each of the children come up to give a prayer. Food is given, and they eat not only meals, but also porridge and fruit. After the pediatric clinic was built, it was felt that there was need for elderly care as well as a maternity clinic, and the J. and Janice Jester Maternity and Outpatient Clinic was built. This averages 40 patients a day, averages 4 deliveries a week, and both prenatal and health education is given as well as education for health at the schools. This is a picture of the J. and Janice Jester Outpatient Clinic. And this is one of the nurses working there. Working with us, the community itself of Papoli developed their own nonprofit called Pakadep. This was established in 2010 as an NGO to support the community with a commitment to fighting disease, poverty, and ignorance. There are 33 paid employees and 220 volunteers in the community. The community development consists of community facilitators who participate in microfinancing, widows' homes, income-generating activities, Christmas in Africa oversight, agricultural improvement, and linkage to government extension services. The Moringa project is one that has really grown and helped with the malnutrition in the community. This is a group meeting for their microfinance where they not only support financially but also emotionally and socially the women there. There's also a water usage committee which consists of 66 volunteers in the 11 subgroups, so 6 volunteers per subgroups. These are in charge of maintenance and improvement of each water source. Since 2006, when the wells first were started, there has been no waterborne disease in this community. And this is an example of one of the wells. There are also community teams that are there for health effort. There are 55 volunteers in this. These instruct, educate, and help follow up on public health issues such as sanitation, vaccination, waste management, and nutrition. And this is an example of one of the volunteers who has the schedule for the next meeting for the month. We have learned that these people not only are committed to improving their community, but they take pride and ownership in it, and that has been a beautiful thing to see. It has truly been an honor and a privilege to partner with these people who have committed to work together for the common good of their community, and in so doing have taught us all great lessons. Thank you.